Okay. Well, first of all, thank you everyone for joining us. My name is Jim Morrison. I'm the Vice President of Legislation for CAHU. We have Faith Borges, who's our legislative advocate with Cal Advocates on, and we are happy that you have taken the time to join our webinar to go through the 2019 legislative update. Obviously, things have changed. We have a lot of new elected officials, and so we are excited to give you an update of what we have already heard, what we've seen so far, and kind of what to expect this year. So with that being said, we are going to go ahead and get started. So Kimmy, if you wouldn't mind going to our first slide, please.
Okay, so we're going to start. Before we talk to you about the changes here in California, it's very helpful to have some context at the federal level. So just a quick recap. After the elections this past November, Republicans gained seats in the Senate and increased their majority, and Democrats picked up seats in the House to reclaim their majority. We do want to stop here and note briefly that the leadership of both parties in the House is from California. So interesting dynamics there as we talk about changes on the state level and any interactions that the state here has with the federal government. There is a nexus between the leadership of both parties. And also want to highlight, now that the House is divided, there's also a limitation in terms of significant healthcare reforms that we're likely to see at the federal level. So now with the House being split, it's far more less likely to see repeal and replace efforts around the Affordable Care Act or single payer efforts or Medicare for All being another term to come forward while the House is split. There was an excellent overview of changes at the federal level that CAHU, our national affiliate, did back in November, and I believe those slides are posted. So for anyone really interested in what's happening at the federal level, we would encourage you to revisit those slides.
Great. All right. Thank you. Next slide. So, back one. So also on the federal level, a ruling out of Texas from a Texas district court basically declared that the Affordable Care Act, or ACA, was unconstitutional. And so it was on a technicality in the relationship to the individual mandate and penalty. Obviously, that is big news. However, that basically, the judge who issued that has already indicated that the law will still remain in place. It'll need to work its way through the court system. And just as a refresher, the Affordable Care Act has been in front of the Supreme Court once before and has already been reaffirmed. So it may be a little bit of an uphill battle for this to actually come to fruition. In addition, California is one of a few states that created what we call mirror legislation when the Affordable Care Act was put into place. That essentially means that even if things change on a federal level, that the California legislature would have to basically implement new laws to either match what was happening on the federal level, or they could stay this as is. Now, there's some complicating factors when it comes to funding for certain social insurance programs like Medi-Cal, et cetera, but just know that it would basically be a significant set of changes that would require additional changes at the California level. Next slide, please. So that kind of gives you a quick overview on the federal side of things. As we go into California, or as we leave the federal side, it wasn't so much the blue wave that you heard about on a national basis. As Faith mentioned, the Senate picked up some seats on the Republican side. The Democrats took back the House. So it's a little bit of a balance. In California, we could argue that it was a tsunami. And so in heavily Republican districts like Orange County, took a lot of hits in the Republican Party and basically became Democrat across the board. So we essentially have supermajorities in both the Senate and Assembly. You can see the numbers there on the screen. We also just want to point out that the Republican registration in some cases is actually coming in third after no preference or independent. And then the state of California has, through former Governor Brown, the Attorney General, and now the new governor, basically likes to push back against the Trump administration. We have sued the Trump administration as a state. Obviously, there's been Twitter wars and all these other things. So it's going to be kind of, whatever the federal government wants, the state of California, from a legislative perspective, tends to push back the opposite way. We saw that last year with the elimination of short-term health insurance plans in the state of California, while the Trump administration was kind of enhancing those as an alternative to typical ACA plans. So just as an example. From the state leadership standpoint in the committees, from the Democratic side, those pretty much stayed consistent. So we didn't see dramatic, even though we saw a lot of new names, we didn't see dramatic changes in the Democratic committee positions. However, the Republican leadership has changed in both the Senate and the Assembly. Next
I want to stop right there and point out briefly that there are two special elections that are going to be coming up. Former Senator Ricardo Lara, who was one of the joint authors of SB 562, which was a single-payer legislation that was introduced last cycle, has gone on to statewide office. He is the new insurance commissioner. So he now has a special election that was actually just declared to be happening on June 4th, with primaries on March 26th to fill that vacant seat. It's a very solid Democrat stronghold seat, so pretty crowded field of candidates from the Democratic side of the aisle declaring their candidacy for that vacant seat. And the other vacancy was on the opposite end of the spectrum. Republican Senator Ted Gaines, who also is an insurance agent, won his Board of Equalization seat. So that seat in a pretty strong Republican area from about the northern part of Sacramento all the way up to the Oregon border is that district. Will be having a special election. One of the candidates who is running for that open seat is former Republican leader Brian Dahle. So with his candidacy now declared for the Senate, he is no longer the Republican leader in the Assembly. That role was transitioned over to Assemblywoman Marie Waldron. And as of, I believe, just yesterday, the Senate has declared a change in leadership from Senator Patricia Bates, now turning leadership over on March 1st to incoming Senator Shannon Grove, who was formerly an Assembly member from the Central Valley area. So changes in leadership on the Republican side, which is not uncommon, particularly after election cycles like the one we just saw here in the state, where there was a significant depletion of seats that were retained by Republican members. So they changed up their leadership.
Great. Thank you very much, Faith. All right, next slide, please, Kimmy.
Okay, so Governor Newsom is the new governor here in the state of California. He won that role pretty handily in the last election in November and was just sworn into office on the 7th. And as you'll see by this little clip here of the press release that he issued on his first day in office, there were a number of first-in-the-nation executive orders. So that's something that we have become accustomed to at the federal level, both in the Trump administration and in previous administrations, seeing executive orders, but not traditionally something you see at the state level. So I think for those of us that are in the Sacramento space, it was a bit of a surprise to see this new form of legislating and communication come forward, particularly just within hours of having taken the oath of office. So we, as CAHU, did send out a press release as soon as this came out, not stating any position that CAHU has, but forwarding on the press release from Gavin Newsom so folks could read the hyperlinked language of the new executive orders and also the preview of the budget that was released in that same press release here. We have since received a more in-depth look at the budget, with the summary being 280 pages, so still pretty expansive, but that came out on the 10th, and that language is available online for anybody looking to delve into that. But we're going to focus on just a couple of the highlights and key points, and want to remind folks that CAHU has not taken a position on any of these measures here. We have our normal legislative council process that will review budget proposals and legislative proposals in depth and we'll vote and make recommendations to the board that will also take another vote. So at this point, this is pretty high-level information that we want to make sure our members are aware of, particularly as your clients might be asking questions in the coming weeks before some of these things are final. But the budget itself, and we'll talk about this in a few slides, does have several months before it needs to be enacted, and there will be many changes before that time. But these executive orders did a number of things. One of them, the governor decided to create a new state Surgeon General that will be looking to address the root causes of Californians' health challenges and inequities. Language from the press release shows that this new officer is going to work together with the insights of the medical community, public health experts, advocates, the public at large to address the underlying causes of health concerns here in California. There was another executive order, this one probably garnering a little bit more of the media attention, that centers around the cost of pharmaceuticals at the state level. And first, we'd like to applaud this new administration. It's something that CAHU has talked about for a long time, looking for solutions to confront the cost and affordability issues we have here in California, and not just looking at the cost of insurance, but the root cost of care. And there are many number of studies that highlight the cost that pharmaceutical drug prices have on that overall premium cost of care, not just the cost of insurance. So this is looking to consolidate the state's buying power of pharmaceutical drugs. The executive order laid out a request that departments that normally purchase drugs separately will work together in a collaborative to negotiate with pharmaceutical companies, and that ultimately this expansion of what would be state agencies to start will ultimately include private businesses and health plans in encouraging them to consolidate their buying power. A number of articles have come out since then, both positive and skeptical about the way that this might likely play out, but it is certainly, as I stated at the beginning, a big step in showing that there are going to be efforts from this administration around tackling the cost of healthcare, and particularly around pharmaceutical drugs, which we've seen an increasing number of legislation in the past few years about. Jim, I'm going to pause briefly and see if you wanted to add anything there.
No, you hit it on the head. The only thing I would add for the most part on that is that really the beginning of this is going to start with the top 25 most popular prescribed medications. So it's not this massive blanket, and it is a step in the right direction from the standpoint of they're looking at size and leverage to negotiate prices across all government agencies for now, and then in the future could expand it to additional outside parties such as small businesses or large businesses, health plans, as Faith mentioned. So with that, let's move on to the next slide, please. So one of the things that was also in the press release, and then a letter that the Newsom administration sent to the Trump as well as some other federal agencies, was on expanding coverage, using the term universal coverage, et cetera. So I wanted just to take a moment and kind of talk about how the dialogue from single payer, which we've had in the past in California, has really changed a little bit going forward. So the last couple of years, we had the nurses bill, that Senate Bill 562, that basically was a true single payer system in its proposed format. It would replace all of Medi-Cal, Medicaid, Medicare, private insurance, pretty much everything across the board would have been replaced through Senate Bill 562 with one payer, one everything. Everything that was not covered by 562 could be sold, but if there was any overlap, that would be prohibited. So that was obviously the bill that died late last year, and it never went forward due to some funding concerns being in excess of $400 billion. So the terms now that the new governor are using are basically universal coverage, which basically is going to be expansion of coverage to documented and undocumented, and then also more on the premise of continuing to expand coverage in a Medicare expansion, or some of the terminology we hear is Medicare for all. So that's kind of a different tone than what we saw over the last several months. And this would also include a public-private partnership if, in fact, it did go forward. So we just wanted to point that out to you. Faith, do you have anything to add on this?
Actually, Kimmy, if you could click to the next slide, because it'll show it in greater detail.
Perfect.
So here we actually have a few excerpts from that letter from the Newsom administration to President Trump and congressional and Senate leaders, and want to point out a few things for you here. In expressing the need or his desire for California to move into a single payer model, there's some specific language that's used here. So, and again, picking up kind of in the middle of an idea, requesting flexibility for the state of California, we must have the federal tools to support California's ability to provide quality health care for everyone, financed through a single payer model like Medicare. So what the past slide was attempting to show is that we're seeing here single payer be defined more as a Medicare for all model than a true single payer. So we're looking at his definition, and it's showing single payer in the way that it's being used by the new administration is more of a Medicare for all model than an SB 562 model, which is true single payer. A lot of times the analogy is made of, the DMV of healthcare, where there's no alternative outside of that system for the public to use. It's a true single payer system. So we're seeing a different example here. And then one other excerpt to highlight from that letter, that same letter, talks about the concept of using competition to lower costs, not only for those in the California marketplace, but also for the 2.4 million in the individual market. So the concept again here, in some phrases we're picking up, are competition. So again, alluding that this new administration, when they're using the phrase single payer, is not referring to the model that we saw outlined in SB 562, but does allow for things like competition and then public-private partnership as exists in a true Medicare for all model.
And then I would just add that, as you can imagine, based on the earlier comments, that the Trump administration is unlikely to be very cooperative in this request. It's that opposite kind of approach to things. So this was a very symbolic letter, very succinct in his goals and his plan and what he's requesting from, but we are assuming that the Trump administration is probably not going to be extremely eager to grant this request.
And the request, just one other additional highlight. Sorry about that, Jim. We had predicted to see a number of waivers, a 1332 or 1115 for any of you kind of wonky folks out there. But what we saw was this new administration pursue a different avenue altogether, requesting an innovation waiver from the president and Congress. So allowing California to be flexible in using the funds that it receives from the federal government. And I concur with Jim's analysis that very unlikely that the Trump administration and a Republican-controlled Senate is going to want to allow California flexibility to pursue things like single payer.
Great. All right. Thank you very much, Faith. Next slide, please.
So one other piece of information that we think is critical to the conversation as we look at single payer moving forward in California is a bill that was passed and signed into law last year. So there was a health omnibus bill, which means that there's a number of health components that the legislature looks at that passed, and it created the Council of Healthcare Delivery Systems in California. So it's an independent body that is charged with developing a plan by October 1st of 2021 that includes options that they recommend to the legislature for advancing progress towards a single payer system in California. And there was another bit of information. AB 2472 expanded that request of that council, not just to look at creating a unified financing system, but to also explore a public health insurance option. So the legislature right now is, I think, going to be waiting to see what this council that they just created last year comes up with in terms of what are the plans, identifying obstacles, like what will California do if the federal makeup remains the same, if we see a re-election of the Trump administration, if Congress remains divided, how can California realistically move forward at a state level to explore things like public options and universal financing system. So this issue is being studied, and those reports will come to the legislature by October 1st of 2021. But there may be a pause here as the logistics are examined in greater detail.
So the point of this slide is to say, even if all the stars aligned and something wanted to, the administration wanted to go explore alternative methods, they're probably going to wait until, at minimum, this report comes out to decide how to handle these obstacles, what barriers exist, et cetera. So the point of the matter is the sky is not falling. Health insurance agents aren't out of business. There's a time process that's going to be involved to move on. So that's why we wanted just to kind of provide some information on that. All right, so next slide, please, Kimmy. So we're going to transition to some of the things that the governor is proposing going forward. And so, Kimmy. So, back one. So one of the big things that he mentioned in his inaugural speech was the basically bringing back the individual mandate. So many of you are well aware that the Trump administration passed tax reform last year, and one of the items in that tax package was the change on the individual mandate. So there is still a mandate, but the penalty has been reduced to zero. So that is something that is on a federal level. So starting in 2019, the penalty would be zero. So one of the things Governor Newsom has mentioned is wanting to bring that back and reimposing a mandate at the state level, very similar to what some other states have done a little bit further east. So that is one of the two items that he mentioned. And then that penalty would help basically raise income or funds. And they would use those funds to expand on the subsidies. So as many of you are well aware, in the individual market, that if they go through Covered California, that be members, they can get subsidies or financial assistance up to 400% of the federal poverty level. This would expand that 400% to up to 600%. So as you can see, it would change the individual household of one from 48,000 to about 72,000, a family of four up to about 150,000. So, however, that being said, they would have, there are some kind of obstacles they have to get through. One, you have the federal subsidies that Covered California is already positioned to receive. The state would have to create a program in which how to get their portion of those subsidies to Covered California. In addition, on the surface, the subsidies are not substantial like they are on the federal side for that difference between 400 and 600%. So I think we have an example here that, some of the, and don't get me wrong, $70 is $70. So anything to help make healthcare more affordable can be positive, but they may not be at the same level. And we've seen a range, like I said, it might cap out about $70 a month. So it would help, but it wouldn't necessarily be some of the game-changing kind of differences that people have talked about in the past. Anything you want to add on that, Faith?
Nope, great job.
Okay. All right, so let's go to the next slide. So before Faith jumps in on this one, I do want to talk about, so there's a lot of moving pieces to this, all right? So nothing's going to happen overnight. There's some, you can have a vision, you can have goals, but there's a lot of moving pieces to this. So we wanted to basically kind of give you an overview of the major pieces. And then, so part of that is, what does the process for legislative change look like? And so Faith, with that, I'm going to let you take it away.
Thank you. So the budget, as it was just proposed by the governor, is going to go through a number of budget hearings, and then also a number of these larger items will probably go through policy channels as well. So there'll be policy hearings, fiscal considerations, and there's also going to be revisions, particularly one we call the May revise, where the Department of Finance and the administration is going to have to take a look and see what tax revenue actually comes in. This budget is proposed based on an assumption of moderate growth, but there are any number of changes that could transpire. We just saw the intention to declare bankruptcy by PG&E, a very big fiscal concern here in the state. So any number of things change and are in flux. So the final budget will be passed by June 15th, which is a statutory deadline, but there are a number of changes and revisions that the governor is going to need to work out with both houses of the legislature, who have their own sets of priorities and asks on a basis moving forward. So CAHU will be very engaged in that process through our role with the Legislative Council, and then also with positions recommended up to the board. And we would encourage you to engage at your local level and to send Jim and I feedback. We have representatives on a number of state agency councils represented on Covered California working groups, et cetera. So we really do value your input and feedback, but there's a long way to go before any of this is in its final form. But what we do have is kind of a lay of the land in terms of this administration's wish list, if you will. And from a policy standpoint, there are still a few weeks remaining for bills to be introduced. The deadline is February 22nd, but then of course we also see significant amendments made to things like spot bill, placeholder legislation. So this will remain an ongoing, engaging process until the legislature adjourns in September.
Great. And I also just want to point out that with the exception of the state surgeon general and the individual mandate, almost everything in his wish list is something that we've seen before. So a lot of these bills have been analyzed, reviewed in pretty good detail last year, but they died for many reasons. They either got with pullback by the author, they didn't get out of committee, it was more of a test the water. So there was a number of different things. So a lot of this is not a surprise, frankly, and we have a lot of that initial analysis done. Obviously, there's going to be some changes, and we'll be going through that. But I did want to point out that we have a pretty good understanding of kind of their game plan. Okay. All right. Next page, please, or next slide.
Okay, so we want to highlight for you some ways that you can get involved and also a number of resources you may not be aware of. We would, first of all, for those of you that are members here, thank you so much for investing in this industry. We can't thank you enough for your participation in this association, and we would encourage you to invite others to join because truly there's a lot of great work being done on your behalf. One of those efforts is our voter voice system, where we are able to put you in touch with your elected official, where you can share support for legislation or opposition. We go through a lot of effort to craft messages that speak with the CAHU voice, but you're also able to add a personal commentary for something that might be a regional issue for you, but we're able to make that connection and have you communicate directly with your legislator. So please keep a lookout for those voter voice alerts. We do try not to spam your inbox with too many requests, but when something comes up, like the single payer legislation, where it's important that your legislator hears from you, we really value the time that you take to communicate. And to that same effect, we also have a day here at the Capitol that Jim is putting on, and I'll actually turn it over to him briefly because this year is going to be, I truly believe the best one yet, where there's opportunity provided for you to hear from key decision makers and to advocate personally across the street at the Capitol. Jim, if you want to touch on that briefly.
Absolutely. So our Capitol Summit is in late May. This is the opportunity for members to come up. We have a number of speakers over a 2-day period of time. We then go out and we actually have legislative appointments with every single member in the state of California. and it's a great experience. We basically go out and we discuss things like role of the agent, and then at that particular point, we'll have a pretty solid idea of what the game plan is, what the bills look like. We'll have positions and talking points. It's a great experience, even if you're not someone that's experienced in this. It's a great thing to go ahead and experience. Sorry, I'm getting some people saying they can't hear me. Hopefully that's better. So if you're interested in joining the Capitol or participating in the Capitol Summit, please reach out to your local legislative chair at your local chapter, and they will be able to provide detail. We're just in the planning stages of that, so that will be a lot more detail will be coming up on that shortly. In addition, we have a legislative council that is made up of 13 legislative chairs throughout the state of California. In addition to that, the executive board is also part of that council. And once we get past what we refer to as bill review, we will then go on a weekly basis and do a weekly update on Thursday afternoons of what's changed, what's going on, what's been introduced, what's been pulled, what's been gotten amended, whatever it may be. So that is a very, very informative call. And that is not something that you have to be a part of the council. You can listen in to those calls. So if you're interested, we'll have a way to contact us at the end and you can participate. Faith, I'm going to give it back to you for Coalition and PAC.
Okay, and we've got a corresponding slide to this for those of you that are preemptively, I think, going to ask about it. But there has been a coalition that's put together that really wants to address the impacts, the health impacts, not just the financial impacts of what a single-payer system would mean in California. So there's a coalition that CAHU is a part of in partnership with the California Medical Association, the California Hospital Association, California Association of Nurse Practitioners, and a number of other key players in our health space that are working to inform the legislature on what the impacts to care would be, again, not just from a fiscal standpoint of the $400 billion, which Jim mentioned earlier, which just as a point of reference is over double the entire state budget in terms of that cost. And so there's a lot of information that's present around costs associated with that, but truly looking at what the impact to the consumer, to Californians would be if a change like that were to be implemented. And so we're going to have more information on ways that you can get involved, I think, in just another slide, but briefly do want to touch on asking folks to please contribute to our political action committee. This is a wonderful way where you get an opportunity to engage with legislators. We have a great Adopt a Legislator program where we have agents serving as resources for questions that come up at the local level on regional issues surrounding healthcare, and we give you a lot of resources to serve those constituencies. But this is a great opportunity to make sure that our message gets out there and that we are able to engage with key decision makers.
Great. Kimmy, next slide, please.
Okay, so I mentioned before that a true single-payer system is when there's no other alternative that exists outside of that system. So this is kind of a timely messaging point on think the DMV is bad, try single-payer healthcare. If you would like to sign the petition and to be part of that coalition that I just mentioned that is communicating concerns that we have about disrupting California's healthcare and forcing consumers off of their employer-sponsored benefits or out of the VA or out of Medicare coverage and onto this government-run system, please visit the website that is available right here, and you can sign the petition and remain in the loop on those related efforts.
Correct. And if you're wondering how can I write this website down quickly, you can take a quick snippet of it right now, or keep in mind that we are going to be posting this webinar to the CAHU.org website later. Next slide, please. Speaking of the CAHU website, we have a number of resources available to you. So if you are wondering what are some of the definitions and some of the confusing terms that get used, if you go to our website, We have a list of the definitions of what truly a single payer system means versus a Medicare for all versus a private partner or private public partnership, et cetera. So take a look at that. Also, under the legislative tab, you'll have information on the priority bills that I mentioned. So once we get past the legislative session, we, from the standpoint of developing and putting bills out, the Legislative Council does a bill review in March. We then identify our priority bills. We then update those weekly. That weekly update is posted underneath the legislative section of the CAHU.org website. In addition to that, there are links to the coalition. There's also information on events such as the Capitol Summit in May. So we just wanted to point that out, that it is pretty comprehensive and there's a ton of information there for you to take advantage of. With that, we'll go to our last slide, which is going to take us to the questions section. So